Touchstone is an awesome place for post-acute care and recovery. Between the vocational department areas, the cognitive department, our formal therapists who are specifically neuro-trained, it just is the absolute premium in specialized care and the absolute best place to come for any type of neurodiagnosis.
Our specialty is working with neurologically injured individuals who have damage to their brains, but also emotional, cognitive, and behavioral difficulties associated with those injuries.
When Dr. Cassidy was trying to treat patients, he couldn't find a facility that was able to do what he wanted to do. So he decided to create one himself. So we're kind of outside of the box. We think differently. We're very individual in how we choose to treat patients. Not same shoe is going to fit on everyone's foot.
The attitude that we take here at Touchstone towards rehabilitation of patients is that of putting ourselves in the patient's shoes. What would we want for ourselves? If this was our journey in life, what would we expect from the therapist? So in any given day or week, we have probably over 80 different activities that occur here. And of course, not every activity is right for every person. And so we really try to listen to the patient, to always put the patient first, and to really try to incorporate their likes and wants and desires and goals into the actual treatment program.
Many of the settings early on that I had worked in were hospital-based settings. And that's okay if you were going to live in a hospital for the rest of your life. But we're not. Not any of us are going to live in a hospital for the rest of our lives. So Touchstone is a home-like environment where we've specifically set it up to model a step toward home.
The thing that makes Touchstone the most unique and different is probably a notion of our 26-acre campus and all the various buildings and abilities that we have to really individualize people's care, to have so many vocational offerings, so many cognitive offerings, neuropsychology both in English and Spanish. Our therapists here can work on people's gait training and mobility by walking on the beautiful campus, be standing out working on dynamic standing endurance while fishing. To me, those are the types of things that make Touchstone very unique, not just in our attitude of how we approach patient care, but even the environment at Touchstone.
When our brains themselves are hurt, our environment needs to provide a safety net for people so that they can try out new things and see if those new things that they're learning in therapy can carry over to living in their homes here and can also carry over to real-world activities. We're always pitching to the patient's strengths. Sure, we want to remediate deficits wherever we can, but I don't really care if an arm can move if that arm can't do anything. So it's vital in my mind that as we get arms moving and we get hands working, that those arms and hands learn to do something, like helping the person use those structural strengths that they have, compensate for the deficits that may be there, but to have those things all work in harmony with our therapy team to make someone able to return to life and have it work for them.